With funding from Environment and Climate Change Canada, the Canadian Coalition for Green Healthcare led a project to demonstrate that hospital-based use of personal protective equipment, also commonly known as PPE, can be successfully accomplished by applying the principles of a circular economy, in particular through cycles of reuse. As part of this project, the Coalition has held 7 roundtables across the country, conducted surveys with individuals and businesses interested in PPE, and interviewed healthcare workers across Canada to hear their opinions and experiences with reusable PPE. Through these roundtables, surveys, and interviews, 3 major themes emerged: safety, security, and sustainability. In this video, you will hear from health professionals as they describe their use of reusable PPE and why they chose to use it. We hope you enjoy our video.
Switching to reusables is extremely important in helping healthcare facilities become more sustainable because we already use a lot of single-use materials and then throw them out. Even though there are efforts to recycle some of these materials, recycling is really not going to reduce the overall environmental impact. By moving to reusables, we could work towards a circular economy and reduce our environmental impact. We've also found that reusables are much more resilient in the supply chain than disposables.
Our health system has become increasingly reliant on single-use items, including disposable N95 respirators and disposable gowns, all of which create more waste and emissions. As we learned in the early days of the pandemic, this is not sustainable, and it leaves our supply chains vulnerable to disruption. It's a lot easier to scale up your reuse cycles, such as laundering gowns or replacing the filters in your reusable respirators, than it is to manufacture more of something. And of course, it creates less pollution.
Early in the pandemic, we ran the risk of running out of necessary PPE as demand for disposable masks, shields, and gowns surged across the world. COVID has showed us how dependent we are on complex supply chains in our health system. Reusable PPE has the benefits of providing excellent protection, minimizes waste, and is always available. Our anesthesia department bought a shared powered air purifying respirator or POWER. By having access to reusable respirators, the supply chain disruptions did not affect our ability to stay protected while doing our job. Reusable PPE needs to be available in all hospital departments. It is less wasteful and offers us superior protection.
During the early period of the pandemic, PPE was a significant concern for all hospitals. In particular, gowns became a significant challenge here at Mackenzie Health. The reusable gown solution from Equitex was an incredible savior in ensuring that we could continue to provide care to patients. Not only did it give us a predictable supply of product, but the fact that it was also environmentally friendly was an added bonus. We're very thankful for the solution from Equitex.
The idea of safety of single-use disposable consumables has been very successfully perpetuated by industry, such that the entire landscape has shifted, making it easier for hospitals to be reliant on single-use disposables, when in fact there are no data to back up that claim of improved safety from an infection prevention and control perspective.
Sometimes people just think it's easier to say like disposables are safer because of that single-use perspective. The misconceptions between disposables being safer, I think there has in the past been a lot of discussion around planetary health and infection prevention control being on opposite sides of the spectrum. I work with some experts and clinicians focused in infection prevention control who have really been trying to drive forward the safety elements of reusables, both from elastomeric respirators or reusable gowns, equipment in place that makes it more sustainable, but also safer.
When I wear reusable gowns, I feel just as safe and comfortable when treating my patients, maybe even more so compared to the disposable options. By transitioning to a reusable PPE system, hospitals could align sustainability goals with staff safety goals and achieve a major win. This was the case at the facility I work, where the disposable gowns caused the nurses to overheat and created an unsafe work environment. By transitioning to reusable gowns, we boosted staff morale and significantly reduced our ecological footprint.
So we are creating a healthcare crisis with what we do as healthcare professionals. It is actually an incredible conundrum, and we are all somewhat hypocritical if we do not start to take responsibility for our professional activities. Because the amount of waste we generate, if we were to be considered collectively, all healthcare professionals globally as a country, we would be the 5th worst polluter as a country on the globe. I found that shocking when I found that out, and but it makes sense when you think about it, because we generate so much waste.
So this idea that we can just live our lives with single-use disposable things that are manufactured, that consume natural resources, we use them for seconds to minutes and then we throw them out, that is an inherently unsustainable relationship with the natural world. And it is an irresponsible and egregious use of natural resources.
The pandemic highlighted the excessive waste produced in healthcare and the precarious nature of supply chains when single-use disposable PPE is relied upon. Reusable PPE is less wasteful, as effective, and likely far less expensive to use than disposables. Our healthcare system has to rethink PPE and take responsibility for its effects on the environment.
Working in healthcare, we use so much disposable PPE on a daily basis. Peeling plastic layers off disposable gowns and shields feels like peeling off, layer by layer, any hope we have of being environmentally responsible. We aim to make people healthier. We can and should aim to make the world healthier too.
Because we are healthcare professionals, and single-use items are destroying the world and creating a health hazard. They simply are. And to me, it is completely ridiculous to not realize that we have to be part of the solution to this problem.